Calcium is a very important nutrient for building strong bones and teeth, but it does so much more. In fact, your body needs sufficient amounts of this mineral for proper muscle contraction, nerve impulse transmission, enzyme activation, and hormone secretion. So, if you aren't getting enough calcium in your diet, there are several signs and symptoms that may indicate a deficiency. And some of these signs can be pretty sneaky because they mimic other conditions. In today's video, we will share with you the top 5 signs that you might be low in calcium, especially if you are over the age of 50. The normal amount of calcium in the blood for adults is between 8.6 to 10.4 milligrams per deciliter, or 2.1 to 2.6 millimoles per liter. When the blood calcium falls below this level, the body tries to compensate by pulling calcium out of the bones, which can lead to decreased bone density and an increased risk of fractures. This process is called osteoclast activation. The first sign of low calcium is osteoporosis, or low bone mass. Osteoporosis is a condition in which the bones become weak and brittle due to a loss of bone mass and density. This can lead to an increased risk of fractures, especially of the hip, spine, and wrist. As we age, our bodies naturally lose bone mass and density, which makes us more susceptible to osteoporosis. However, a severe calcium deficiency can also contribute to the development of this condition. In addition to osteoporosis, other bone-related problems like bone pain, especially in the back or ribs, can also indicate a calcium deficiency. This is because when your body doesn't have enough calcium, it will start to pull from your bones to try and maintain the right balance. This can result in discomfort and pain in the areas where the bones are being pulled from. The second sign is chronic fatigue. Fatigue is a common symptom of many different conditions, so it can sometimes be difficult to identify the underlying cause. However, when it comes to chronic fatigue, a calcium deficiency may be to blame. Calcium plays a role in muscle contraction, so a deficiency can lead to muscle weakness and fatigue. In addition, calcium is involved in the production of energy in the body. So, when you're low in this mineral, your cells may not be able to produce the energy they need to function properly, which can leave you feeling tired and drained. If this is not relieved by rest, it could be time to check your calcium levels. The third sign is frequent headaches. Headaches are another common symptom that can be caused by a variety of factors, including stress, dehydration, and lack of sleep. However, a severe calcium deficiency can also contribute to the pain. When the body doesn't have enough calcium, it can cause the muscles around the blood vessels to contract, leading to an increase in blood pressure. This can put a strain on the arteries and veins, leading to the formation of a blood clot. The blood clot then puts pressure on the nerves in the area, resulting in a headache. If you've tried everything to relieve your headaches and nothing seems to work, it may be worth checking your calcium levels. The fourth sign is muscle cramps. Muscle cramps can be caused by a number of factors, including dehydration, overexertion, and electrolyte imbalance. When you're low in calcium, your muscles may not be able to contract properly, leading to cramps and spasms. In addition, a calcium deficiency can also lead to nerve problems, which can trigger muscle cramps. This is particularly common in athletes who sweat a lot because they lose fluids and electrolytes, including calcium, through their sweat. So, if you're an athlete and you're experiencing frequent muscle cramps, it may be a sign that you need to increase your calcium intake. And no. 5 is insomnia. If you're having trouble sleeping, a calcium deficiency may be the culprit. Calcium helps to relax the muscles, so a deficiency can make it difficult to fall asleep and stay that way. In addition, calcium is involved in the production of melatonin, a hormone that helps to regulate sleep cycles. So when you're low in this mineral, your body may not be able to produce enough melatonin, leading to sleep problems. If you are over 50 years old and have one or more of these symptoms, it may be a good idea to get your calcium levels checked. There are many foods that are high in calcium, such as dairy products, leafy green vegetables, and fortified foods. If you eat a balanced diet and don't smoke or drink alcohol excessively, you should be able to get all the calcium you need from your diet alone. However, as we age, our bodies become less efficient at absorbing calcium from food. So you may need to take a supplement to meet your daily requirements. The recommended daily intake of calcium for women over 50 is 1,200 milligrams per day, while for men over 50, it is 1,000 milligrams per day. Thank you so much for watching this video. If you found it helpful, please let us know in the comments below. And if you know of any other signs of low calcium that we didn't mention, please share them with us as well. We would love to hear from you. Make sure to subscribe to stay updated on our latest health and wellness tips. And do not forget to like and share this video with your friends and family if you think it will be helpful to them. We look forward to seeing you in our next video.